is your heart? Do you dream of having a healthy heart even as you age? Good thing, Puritan Sprite CoQ10 Easy Sorb is finally here, an FDA-approved supplement that helps your body replenish CoQ10 naturally in a fast absorption soft gel form to help you have a healthier heart. It also helps you have a natural boost in energy so you can be more, do more.
One of the high-quality products by Puritan's Pride, the leading supplement brand in the U.S. for over 40 years, now available in the Philippines. Puritan's Pride, your healthiest you for less.
Go ahead with more energy and stronger heart. Go get Puritan Sprite CoQ10 Easy Sorb now.
Hi, Wellnessable fam. It's Mickey Sachiko again. I hope you're all keeping safe. Nako, for the past few months, it has been really challenging for all of us, and stress, sobrang, it's at all-time high right now. And there are studies that are showing that stress are affecting our heart health, and that is regardless of our age. And on top of that, COVID-19 also impacts not just our respiratory health, but also our heart health, our cardiovascular health. So today we have a very special guest. I'm very grateful for our guest for today because he will be helping us out on some of the pressing health questions related to cardiovascular health. He is a cardiovascular and thoracic surgeon. He's the head of adult cardiothoracic surgery of Philippine Heart Center, and he's the former president of PATACSI, a non-government organization of all certified thoracic and cardiovascular surgeons in the Philippines. Let's give it up for Dr. Christopher Cheng. Hi, Doc Chris.
Hello, Mickey. Thank you very much, first of all, for inviting me over. And I heard the introduction, so medyo overrated na, no? Overrated na by then. I hope it's okay with you na Taglish na lang tayo, no? Most of the people naman, Filipinos usually speak Taglish. Glad again to be here.
Yeah, thank you so much, Doc. I'm so excited sa magiging topic natin for today. I know busy kayo, Doc, so I'll get right to the most important question that a lot of our viewers are probably wondering about. They're saying kasi that yung COVID-19 stress and anxiety na nararamdaman ng marami sa atin ngayon ay nagkakaroon ng negative impact sa ating heart health, and that's regardless if meron tayong underlying health condition or meron. So ano po yung masasabi niyo about that, and how can we, improve our heart health during these difficult times?
Mickey, we have two groups of people here, no? One is those who already have a heart problem, and another group is those people na walang sakit naman, ano? Like if I'm a teenager or I'm in early 20s, I don't have any heart problem, and both group can be affected by the COVID virus. So what will happen to those group na may sakit na? So the same. Kung we're talking of those people with rheumatic heart disease or those people with coronary artery disease. I think coronary artery disease is the condition where your arteries or the blood supply in your hearts are blocked totally or partially blocked. So pwede kayong magkaroon ng heart attack. So if the COVID comes, ano yung magiging direct effect sa mga pasyenteng ito, no? Mga people who has coronary artery disease. What we are seeing now is most of them don't want to see their doctors. And of course, we can't blame them kasi hospital is the best place for you to get an infection. But of course, in fairness, the people there knows how to be careful, do proper protections for themselves. But these people kasi ano yung mga risk factors? When you go to a clinic pala, no, you see a lot of people. Actually, hindi naman lahat sila may for operations. A lot of them will be coming to see the doctor for blood pressure problems, diabetes, cholesterol abnormalities of blood. So these are actually the risk factors for causing coronary artery disease. So if you don't go to see your doctors, your blood pressure, your blood sugar, your cholesterol, sometimes poorly controlled sila eh. So ang chances, it's not good for your heart. And then when you go into another group of people naman, yung wala talaga namang sakit, na underlying na sakit sa heart, well, any viral diseases can actually, if this affect your immune system, theoretically can cause, can in a way damage your heart, like your myocarditis, some cause of inflammation to your heart. Although, madalang mangyari ito. Madalang naman. Other things that we can control are like smoking and yung inactivity and yung cholesterol level sa blood. So ito meron tayong control. So these are the factors actually that can cause heart problem. So when we say that in the usually mga 50s or 60s or 70s nagkakaroon ng heart problem, maybe siguro now ang mga effects nito kasi pagkabata pa lang you're sometimes in the house, you don't eat healthy food. Bata pa lang in their 20s, 30s, they smoke. They don't do regular activities. So, pwedeng mangyari na earlier na onset. And siguro dahil nowadays, nagpapa-check up sila eh. In their 30s, when you get hired, you get parang annual check-up. So, mas napipick up. And then, of course, the stress of the environment now. Ito now with COVID. Of course, ibang klaseng stress. It's not only the stress of work. It's the stress of monetary, financial stress naman tayo ngayon. Saka yung fear. Malaking bagay yung fear. Yes.
Ayun nga po, Doc, na like a lot of people now, sobrang nakaka-experience sila ng yung na-mention nyo, stress and then anxiety. So talagang tinatamaan din yung ating heart health. Ano po yung mga, maliban sa na-mention nyo kanina, ano po yung mga specific habits po na sa tingin nyo makakatulong para maalagaan naman natin ang ating mga puso?
Yes, thank you for mentioning that. Actually, it's common sense. I'm sure you would know kung ano yung mga pinagbabawal ng mga magulang or mga teacher natin before. Bawal ang smoking. Smoking talaga has a big impact on the development of coronary artery disease. Yung pagkakain ng mga matatamis, but maybe a lot of people don't know, but yung sugar is carbohydrate. So para sa mga may matataas ng blood sugar, bawal po ang kumain ng maraming kanin. Tayo po mga Pilipino, 'di ba? We are a kanin republic eh. So bawas siguro sa cholesterol. Ano pa may bawas para sa kanin. Ano pa ba yung carbohydrate? Bread is carbohydrate. Sugar is carbohydrate. Minsan hindi nga kumakain ng kanin pero panay naman ng iced tea. Iced tea, ang tamis-tamis is also carbohydrate. And sa mga pag-prevent naman ng mga hypertension, yung mga maalat, mahilig tayo sa lahat ng mga pagkain. Kailangan may patis, may toyo. So, pag tumaas ang tumaas ang sodium level sa katawan, sodium chloride level, tataas ang blood pressure. And then, of course, alam natin yung mga balat ng lechon, balat ng manok. Actually, the good ones, the red meat, lahat ng mga masasarap usually, sila yung nagkukos ng matataas na level, nagpapataas ng level ng cholesterol. So, yeah, if we can take care of that, we can, of course, alam din natin na smoking is not good. But what people know most of the time is smoking is bad for the lungs, but it's very, very bad also for the heart.
So talagang hindi lang niya tinatamaan yung lung health mo pala, pati yung heart health rin.
Yes, that's true. And then, of course, kailangan natin mag-exercise. Now we have all these gadgets. Pinagbawalan pa tayo lumabas ng bahay ngayon. And then, yung mga unlimited na mga video sa TV. So, talagang may tendency talaga tayo maging couch potatoes. Couch potatoes, yung mga walang ginawa kundi manood ng mga movies sa bahay. So, talagang at risk tayo. Medyo at risk.
I saw this article, Doc. It says na sitting is the new smoking. So, if you sit a lot all day, every day, at hindi ka gumagalaw, nag-exercise, it's like you're smoking as well.
That's true. That's very true. Smoking, di ba, now it's less na, hindi na katulad ng before. Kasi daming areas na bawal ng smoking. And hindi lang yung smoking ang bad, ano? Even yung sinatawag na second-hand smoking.
Yes.
Yes, ano?
Mhm.
Lugi ka, no? Hindi ka nag-enjoy. Yung iba nag-smoke, nalanghap mo, pati ikaw meron ng cancer.
Yun nga eh. So kailangan talaga wellnessable fam. Kailangan ingat-ingat tayo, not just
Yes.
for having that as a habit, but for being a victim of secondhand smoke. Nako, kailangan iwas-iwas tayo sa mga ganyang mga tao. And I also saw this article from DOH, Doc, na pag smoker ka, at nakakuha ka ng COVID-19, mas magiging komplikado yung sakit mo sa COVID-19 kasi smoker ka.
Yes, that's true. This time naman kasi I'm sure everybody knows ang pinaka organ system na affected sa COVID are the lungs. So if you're smoking, talagang lungs ang primary talagang damage na tissues. If you see nga people na may mga nakikita kami na actual lungs na mga smokers, meron siya mga itim-itim na dots. So nakikita namin sino yung mga smoker pag nakikita namin yung lungs nila. So that's how it affects the lungs. And then kung sakaling may mga super chronic smoker na nagkakaroon na ng mga chronic pulmonary problems, your lungs are not well na nga tapos tatamaan pa siya ng COVID, talagang high risk ka talagang mamatay or magkaroon ng mortality.
Delikado talaga for that.
Yes.
Kanina po na-mention nyo sa sa heart health tips nyo para sa mga walang underlying heart conditions. Now, going naman po sa may mga meron ng existing conditions, no? Like ngayon po, na stressful ngayon ang environment, ano po yung mga tips na may bibigay nyo para dun sa may mga heart conditions during this pandemic?
Well, sabihin nga natin, it's easier said than done, ano? Kasi what I will say is, the best is still keep on seeing your doctors regularly. But if you cannot do that, try to get a hold of your doctor kahit na yung mga teleconsultation. But not all doctors agree to that kasi yung mga ibang doctor, kasi worried sila, halimbawa, if I don't see my patient, hindi ko na-examine, kasi hindi kayang lahat ng bagay through the teleconsultations. Hindi
Yes.
ko kukuha ng blood pressure niya. Meron akong kakapain. Meron akong pakikinggan sa chest niya kung hirap siya huminga.
Yes.
Kung sakaling I diagnose you of something else, pwede mo ako i-demanda siguro kung sakaling. So yung iba, let patients sign waivers, no, na may limitations sa teleconsultations. But most of the people naman are understanding may limitations talaga ang consultations. So hindi dapat masisi yung doktor kung hindi ma-pick up on the whole thing sa patient.
Ayun yung advantage ng technology. You can see your doctor anywhere, anytime. But yung disadvantage niya is pag mga ganun ng level ng condition, hindi masyadong mamo-maximize yung consult.
Yes. Meron din talaga din. But I can still say it's more of the mas maraming advantage. Kasi sometimes a lot of that will save a lot of trips, a lot of natutuwa nga ako na lots of our meetings now well attended and very comfortable kasi if I attend the lecture and I'll be sitting at the back, maya-maya lang antukin na ako eh. But now, the slide presentation is right in front of me. Kahit nasaan ako, di ba? Very clear. The lecturers very clear. Ay mas magandang pick up ko, no? And well, of course, may mga disadvantage din. Pero kung if you have meetings every day, imagine na how much traffic ang mababawas kung sakaling yung iba pwede palang mag-meeting sa web.
Yes, exactly. I think I am so glad you mentioned that, Doc. I think ayun yung kahit na maraming mga challenges yung dinala ng COVID-19, one of the beauty that it brought us is that na-lessen yung traffic. Kasi
yes,
halos
ang dami.
lahat.
Actually, marami rin kasi I'm glad that I am locked in with my family in the house. Di ba mas close kami. Before, pag uwi ako ng bahay, they'll be in their halls studying or wala pa sa bahay. When I wake up, wala na sila. Now they're just here every day. We get to mingle every day. Look at the air now, it's clearer. Look at the water now, wala tayong water crisis. So I think meron din mga positive rin tayo nakuha out of this COVID.
Exactly. And then now that there's a vaccine as well, another big help para sa ekonomiya ng iba't ibang bansa naman. Kasi pag may vaccine natin, pa talagang medyo nalilesen yung mga fears and anxieties. Kasi especially in business perspective as well. Actually, I haven't taken my vaccine yet. I heard that you have taken yours na po, Doc, no?
Yes, kasi merong order of priorities yata ang pagbibigay ng allocation ng mga vaccinations. But still, even if we are given these vaccines, dapat same pa rin ang universal precaution. We still have to wear our mask. We still have to put on our shields, face shields, and we try to practice pa rin yung avoiding, especially when eating, kasi when we were in the office, sometimes I see our secretaries or even our colleagues, sometimes how do you eat? You cannot eat with your mask and your
Without mask.
Yes, so ibig sabihin talagang that's a big risk every time you eat together. So pwede na muna anti-socialing this time and also yun ang nakikita namin minsan. That's why we would discourage that na talagang magkasama kayo. Sabihin nyo na para kayong di ba before, pinagtatawanan natin yung ibang tao para magkaaway ba?
For protection of themselves and the people around them.
Yes, yes. Everybody has to do their big contribution. Ayun nga, nakikita ko, sad to say, if I pass through some road dito, even on my way to work, nakikita ko people walking around a whole street. Halos walang mask. And they're together. And then, ito yung mga areas na maraming tao, na yung mga bahay dikit-dikit. Sometimes, we can't blame them, kasi tatakpan mo yung mukha mo, yung katabi mo naman, halos hindi ka na makapaglayo. There's no space for you to keep away from each other. So it's hard to say, sabi ko nga, it's always easier to say than have it done.
There you go. Well, Nasable fam, you heard it from Dr. Chris na regardless kung nakapag-vaccine ka na or not yet, mask wearing and social distancing and wear a face shield pa rin tayo. So we have to still follow the protocols because, it's still not just for our own sake, para rin sa ikabubuti ng mga tao sa paligid natin. So, Dr. Cheng, right now that you still go to work, and then sometimes you are working from home, ano po yung parang napansin niyo sa mga patients niyo ngayon na na may heart condition sila like?
Mas konti nga pasyente namin ngayon. In the hospitals that I am in, like any other hospitals, if we are operating on COVID patients, ang risk ng surgery is higher. So we have to make sure that before we subject them to yung talagang major operation, which yung pag heart surgery, major yan eh. Pag meron sila active COVID, ang chances of them dying of that procedure is higher, definitely higher. So in order to protect them also and to protect the staff, everybody, from further exposure, usually very strict kami sa screening. In fact, minimize ngayon pati mga bantay eh. Kasi sometimes the bantay are the ones bringing in. Papasok sila and hindi naman sila nakahiga sa bed. Anong ginagawa ng mga bantay usually? They can roam around. So even that, and then di discourage yung na magkaroon ng maraming tao sa lugar. So a hospital with di discourage yung magpunta yung mga tao, mahirap. It's hard to say kasi we're binabalance natin. We want to accept as many patients as we want, and yet we don't want people to come. Parang ganun So we still have to go there to work. Siguro by next week, we will be starting to do again regular operations na katulad ng dati. Kasi we have to hold it for a while para makontrol man lang yung mga infection rate. Saka sunod kami sa ECQ na hindi-declare na binigay ng IATF. So we have to follow that also.
That's a sad thing na nag-lessen yung mga patients going to doctors now, despite the fact that we know that the number of cases for people with heart conditions are increasing. So it's kind of like showing na they're missing their opportunities to go to the doctors. Kasi po yung last year, nagkaroon kami ng breast cancer-free webinar. And then isa sa mga naging findings namin for that is that maraming mga cancer patients who are missing their screenings because of the pandemic. So it sounds like pareho din sa mga
ganyan, yes.
may mga heart problems na miss din nila yung yun nga, yung mga appointments, hindi sila nakakapunta sa doctor. So, which is a bad thing because of course they need to see doctors like you if they have heart problems. So, yeah, I hope take advantage nila yung telemedicine or teleconsultation with doctors para mapangalagaan para nila yung sarili nila.
Well, the upside that I can see about this thing naman is most of the patients, siguro in a way, less ang stress kasi they don't have to travel, they don't have to undergo the traffic, less stress from work, you're in the house. So siguro yun on the positive side, yun lang ang makikita ko na in terms of stress, mapabawasan. And hopefully, because of less stress, less ang chances na mag-undergo sila ng heart attack. Unless mag-aaway na lang sila lagi sa bahay.
Huwag naman sana. Now,
Yes,
speaking of stress pala, Doc, no, kanina, na napag-usapan natin yun, merong another type of topic na sobrang stressful to young people right now and also to people who are not so young. Ito yung nagiging common na. Ito yung tinatawag nilang broken heart syndrome.
Yes, I've heard of that, yes. Actually, it's a scientifically recognized condition. In fact, meron tayong mga articles on that from the American Heart Association, no? And etong broken heart kasi, of course, by the name itself, ang dahilan is severe parang depression, severe emotional affect after something. Whatever dahilan, pwedeng nalugi, pwedeng iniwan ka ng asawa, may namatayan. Ito yung tinatawag na broken heart syndrome or what we call Takotsubo syndrome. Ang symptoms nito kasi is usually just like a heart attack. Para kang, ano yung mga symptoms ng heart attack? Actually, hindi, ang heart attack does not come to us like masakit ang dibdib, hindi eh. Ang talagang genuine na heart attack is parang may nakadagan, parang nangangapal itong dibdib ko sa kaliwang side. Minsan nanlalamig ang kamay ko, and then parang dito hanggang sa left na panga ko, namamanhid, and hirap ako huminga. And then especially if you're doing something stressful, like, of course, so yung iba, for some people, walking is not stressful, but for some people, pag-akit ng hagdanan, ng 3 stories, hihingalin. So, ito yung tinatawag na heart attack, no? Na pwedeng stable angina, pwedeng heart attack. So, if you see a doctor, ito ang nakita namin sa emergency room, pag nakita kitang 20 years old, maaaring sabihin ko, malamang siguro hindi yan coronary disease, no? Kasi napakabata. Even if you're below 30 or 30s, chances are lower. But we still have to treat you and diagnose you like a coronary disease, artery disease. Ibig sabihin, before we can prove na sa broken heart, kasi a broken heart syndrome is usually a temporary syndrome. And hindi naman siya ganun ka-deadly. So what can it cause? It can cause probably heart failure for a while, irregular heart rates. So ang maramdaman ng pasyente parang minsan hirap huminga, minsan hihimatay, magbababa, the blood pressure might drop. So ito pwede mangyari. But the good thing is, this is usually temporary. Temporary siya. So but still, for us, we have to rule out the other deadlier one. Yung totoong heart attack. So nangyayari, the patient will have to undergo ECG, chest x-ray, observation sa hospital maybe ma-admit, and might have to do an 2D echocardiography. So we have to rule that out. Ngayon, the problem is if the patient, which is actually broken heart syndrome, mas madalas pala mangyari sa mga middle-aged people. So ito, 40 plus, 50 plus, we have to rule out coronary artery disease. So mas maraming undergo. Hindi mo basta-basta madidismiss na mukhang hindi siya coronary. So after we rule out coronary artery disease, that's the only time we can probably label it as broken heart. Kasi it's a less harmful situation.
I just wanted to highlight yung sinabi niyo kayo na it's a temporary thing.
Yes,
Nice.
that's good, no? Diba? At least temporary siya.
Yes. And that's the thing like during these times, ang dami na nakakaranas ng broken-heartedness, not just because yung typical reason na naiwanan sila ng ka-relationship nila, pero yung mga nabanggit ko na example na like someone from their family passed away, or maybe they lost their business, or they experience a traumatic incident, nakakakasama yun yeah, broken heart syndrome na
Yes,
nabanggit.
no, napaka-dramatic ng term, no? It's more catchy, Tandi Takuchobo syndrome.
Yun pala, is that scientific term?
Yes, that is the scientific term which is used to describe this situation, itong broken heart na syndrome. Kasi when you say syndrome kasi, it's a parang combination of symptoms. So hindi lang isang symptoms. So may kung ano-anong mga nararamdaman.
So, ngayon, Doc, na-discuss natin yung broken heart syndrome, and na-discuss din natin yung like yung mga heart health tips nyo for those with heart conditions and those without heart conditions. Any last words for those who might have like some issues related to health, who are maybe hesitant about the vaccine? Would you encourage them? Any tips on how they can overcome their fears about the vaccine, or is it really worth it?
Actually, yes, if you talk to any doctor, almost all, if not all, will really recommend na everybody gets vaccinated. And ang tanong is, what brand? Ang sagot ko dyan is, the brand that is soonest. Kasi gusto natin yung imported na brand na from elsewhere, may ideal na gusto akong brand, and then hindi naman nakakarating sa Philippines, no? So usually, if you're going to wait for that, you don't know, baka nagkaroon ka na ng sakit, or yung mga kasamahan niyo nagkasakit na before that can happen. So para sa akin, the first one that is available nandiyan na sa harapan nyo na, tuturukan ka na by next week, get it, have it yourself vaccinated. And then, minsan kasi, we read a lot of news from kung ano-ano mga gamot that might work. And ako, personally, it might work on some people, but I will still want to wait for a formal parang endorsement from your authority namin. Kasi ang mga, sabi natin, ang mga FDA, DOH, KJ sila, no? Kasi okay na sa amin itong gamot na ito, this will work na ito. Hep, hindi pwede, wag muna. They have a very good reason for that. Ang reason is, ang mga gamot na kiniklaim ng iba na nag-work is not made to treat COVID, for one. And they have side effects. Probably, you might give them out of, kahit naman kami mga doktor, sometimes we give unconventional medicine kung out of nothing else to do. So, kung itong pasyente nasa critical, he might die as from the ordinary conventional ways that we're doing. We might try that, no? But if we're going to prescribe that to everybody, malakas ako, bibigyan ako ng gamot na yun na unproven, I will not recommend that. So yung mga doctors na ito, usually, we don't recommend. Kasi lalo kung gagawin mo parang vitamins, one of them is an anti-helminthic. Ibig sabihin, it's an anti-parasitic drug for animals. So hindi namin talaga i-recommend muna for everyday taking without prescription, without a dosage recommendation kasi unlike antibiotics, if you take them, you take it for a week. Kunwari, ito 2 tabs a week, 2 tabs a day, every 8-6 hours. Yung itong isa, wala pa. So anybody can just take them as walang guide. So I will not recommend yung mga ibang gamot na kina-claim ng iba na it will work.
So ngayon po na, like you mentioned din kanina na wag na maging masyadong picky in terms of the brand. Kung
yes,
ano
that's
yung
true.
right there, is kunin na yun. Ano po yung masasabi nyo na yun nga, yung available dito ngayon sa Philippines is yung mababang efficacy rate. Like, syempre, meron din, hindi natin maiwasan, may iba talagang natatakot pa din na gusto pa rin talaga maghintay dun
Well, kasi natatakot sila yung efficacy rate, katulad na nasabi ko, yung sinasabi ng mababang efficacy rate is higher. One, the study was flawed. Ibig sabihin, may question mark yung study. Kasi nga, it was, the test was done on people who are exposed, mga health workers, working in a hospital with COVID. So, higher ang chance na mag-fail kasi kahit na nabigyan ng vaccine, kaya nga katulad ng kiniklaim namin, if you were given a vaccine, you might still get infected. And then if you are giving this to people who are in the hospital working on COVID patients, higher chance of failure. Unlike the other vaccines are given to a general population. General population, ilan doon ang doktor, ilan ang nurses, kokonti lang. So they are not as exposed to COVID as this group. So ang chances na higher success na protection, higher siyempre. So yun mga tinitingnan namin, ano. And then itong brand na ito is saying na almost 100% protection from severe infection. Ibig sabihin, kahit na maraming sa ating tamaan, pero protektado ka na hindi ka magkakaroon severe, mamamatay, which is good enough for me. Okay lang ako ma-infect ng COVID, huwag lang ako mamatay. Yun ang importante. Just like the flu, di ba? Sipon. Na-infect tayo, basta huwag lang tayo mamatay sa sipon. So sa akin, any vaccine is good. And nobody can guarantee na walang complication ng vaccine. Kasi nagkaroon na tayo ng Demvax scare. In fact, pati yung the number of people having this basic, yung mga measles vaccines, even those talagang required, drop. So tumaas ang surge natin ng mga measles incidents now. So it's not good kasi itong Demvax is an unfortunate event, but nagkaroon na maraming mga side effects tuloy din. People got scared. So if there are people there who are still in doubt, I still say na you're probably if you don't want to protect yourself, be a part of the solution. Get yourself vaccinated para mabawasan ang chance na ikaw ang magdala rin ng infection.
I love that. I love that you said that, Doc. Kasi ako yung isa sa mga, to be honest, like last year, hesitant ako about the vaccine. Pero this year, when I did a little digging and research, and then I talked to different doctors, it sounds like it's really a great solution for us to move forward.
Ako rin, ayaw ko magpaturok, unang tanong sa akin magpapabaksin ka ba? Ayoko nga. But of course, if we were to take a deeper look at it, siyempre, we are responsible. As a health worker, I'm responsible, not only for myself now. So I have to get that.
As a frontliner, talagang imperative po siya.
Yes.
Doc, last before we wrap up, baka meron po kayong ma-share wellness tip nyo, health tip nyo.
Kung kulang ang kaalaman, magbasa, mag-research. Nasa bahay tayo, lahat ng tao ngayon may internet. Magbasa tayo, no? And of course, knowing that if we are equipped with all this knowledge armamentarium, wellness is possible, always.
Love it. Thank you so much, Doc, for all the tips and all the things that you shared po. And keep safe.
Keep safe then. Bye-bye.